Hello everybody, welcome to my YouTube channel. It's been a while, right? I'm so sorry. I'm very sorry. Yeah, I remain your favorite family physician, Dr. Elemile Oluwadamlola, simply put, Dr. Dami. The other day I saw a boy with fever, that is elevated body temperature. And before we could say Jack Robinson, the boy started fitting, that is, yeah, he started convulsing. And the mother saw that we were calm all through the situation, just saying this, do this and that. And we maintained a calm disposition. She was panicking, running all over the place. And after the whole scenario, she asked me a very important question. She said, "Doctor, if this had happened at home, what should I have done?" And I thought to myself that it would be good to bring to you, my viewers, especially parents taking care of children, things we can do for our children at home when they come down with illnesses, home care, before you bring them to the hospital. If it's things that you can do at home before you get them to the hospital when they fall ill. And I felt that we should start with fever. Fever is what the things you can do when a child has fever, the things you can do for that child at home or for yourself at home when you have elevated body temperature. I must say that fever itself is not a diagnosis. It's usually secondary to something, and it's better to treat the cause of fever than suppress just suppressing fever alone. So it's usually good to investigate while someone has had a fever, rather than treating just the fever or suppressing the fever alone, because when you suppress the fever, the original cause is still there, and things can blow out of proportion. Things can get complicated if it's not nipping the bud early enough. So in talking about what you do when a child has fever, I would like to start with preventing fever from happening in the first place. Primary prevention. So you don't want your child to have fever. Fever can be caused by myriads of things, but the commonest is usually infections caused by germs, disease-causing organisms. The infections could be viruses, bacteria causes, malaria. Fever can be in very small babies, what the babies we call neonates. Babies less than 28 days. Something as simple as dehydration, or when they have low sugar level, or when the calorie they are getting is not enough, they can come down with fever. Something that simple can cause fever in them. Even malignancies can cause fever. Some cancers, some tumors can cause fever. So you can see that there are so many things that can cause fever, and it's good to treat the underlying cause of fever. So you want to, I already said that infections are the commonest cause of fever, so you want to prevent infections. Common things occur commonly. In order to prevent infections that will lead to fever in your child, you want to ensure that you practice hygiene, regular hand washing, sanitation. We must also teach our children to wash their hands early on, so that they can get built up in them from an early age. They wash their hands after using the loo. After they come back from school, they wash their hands, or they use hand sanitizer. It's a practice that is very essential to preventing the germs, because the germs, we can't see them with their eyes, but they lurk around, and we carry them on our hands. So it's always good to wash our hands, to dispose of our waste, practicing sanitation. So those hygiene practices are very important to prevent mosquito that causes malaria We should encourage our children to sleep under long-lasting insecticide-treated nets. We should do residual spraying. We should ensure that our environment, there are no stagnant water around. There are no things that there are no things that can serve as breeding sites for mosquitoes around our house. We should ensure that the bushes around our houses are cut and all that. So having done all of that, sometimes you still don't have control over things that happen, and then the child will still come down with a fever. So what will you do when your child has a fever? The first thing is to ascertain that there's truly fever. So the practice of touching the body, whether it's subjective, and it depends on the ambient environment, the temperature of the environment. It also depends on your own perceived temperature at that time. So touching a child's body or anyone's body to feel for temperature is not good enough. It's subjective. You need an objective way or method of checking for temperature, and that's with the use of a thermometer. So every mother should have a thermometer in the house. You may not be able to read, and there are different types of thermometers, and you may not be able to read the mercury thermometer, but a digital thermometer can help, will give you the exact value of the temperature of that child, and you place it under the armpit. It beeps. The other sites where we can check for temperature, but the commonest sites, well, that any lay person should be able to do, put it under the armpit, and it checks the temperature. Usually for most digital thermometers, they beep after when you are to remove it from the body. After beeping, you remove it and you check the temperature. Anything greater than 37.2, say the child has fever, and there are levels of fever, but once it's greater than 37.2, you say a child has fever. So what do you do at that point when their child has fever? The first thing to do is to what we call tepid sponging. Mark my words, tepid sponging. Tepid there means lukewarm. You use lukewarm water to tepid sponge. You don't use very hot water, or you use cold water. If you use cold water, it lowers the body temperature. The body wants to reset the temperature, and then the child starts to shiver. So you don't want that happening. So you use a lukewarm water to tepid sponge. Understand that is very key. You must always use a lukewarm water to tepid sponge. That is using clothes and tepid water to dab the whole body. Usually evaporation by cooling takes place, and the temperature lowers for some time. The other thing you can also do, they are over the counter. The child can also take a shower with a lukewarm water, with a tepid water, otherwise known as a lukewarm water. You can also do that. Then you can also give oral drugs, oral paracetamol. I usually discourage people from using ibuprofen as a first line for fever, except it is prescribed at the hospital. So, but one over the counter, what every regular person can use is paracetamol, and you must use the right dose. If you don't know the right dose, you can consult the label, or you call someone who has the information to tell you what dose to do and to give to that child. Usually viral illnesses, they are self-limiting, they go after some time, but as I said, that even when the temperature goes down, it will go down for a while, but when it comes out, it may come back with a vengeance. Having done that, the next step to take is to take the child to the hospital. Usually fever doesn't work alone. It doesn't come alone. It comes with other symptoms. But children sometimes may not be able to tell you what they have. Fever can come with headache, can come with vomiting, can come with loss of appetite, can come with diarrhea, can come with body pains, and they will mean different things. So having done that at home, the next step is to temporarily bring down the temperature so that the child will not convulse. Because if the temperature goes to a certain gets to a certain level, which varies for different children, becomes high grade, a child can convulse from fever, what we call febrile convulsion. We don't want that happening. That's why you say a child has fever, Tepid sponge, can give paracetamol, and the next step is to look for why that child has a fever and treat it. It can range from malaria, upper respiratory tract infection, gastroenteritis, enteric fever. You know, different things can cause fever in a child. The next step is to take that child to the hospital or get a health professional to help you assess the child. Test by vis-a-vis asking history, testing, and then coming to a diagnosis and treating the underlying cause of the fever. I hear mothers say that ara ẹ̀gbóná, mo fún ní paracetamol, ó dẹ̀ lọ. And on the third day, they are coming to the hospital, the child had already convulsed or coming down with, you know, very terrible complications. So in order to prevent that, please, once you do your the simple steps of home care at home, the next step is to seek the help of a healthcare professional to help you find out, unravel the cause of the fever, and then treat properly. I hope you enjoy the series. Next time we'll be talking about something else on home care for children, things you can do at home before you can get the assistance or prior to the assistance of a healthcare professional. Stay blessed. God bless you. Peace.